Dr. Katie Kangas owns and operates Integrative Veterinary Care, a private practice right here in San Diego, offering holistic and integrative health care for pets. She achieved her acupuncture certification at the Chi Institute in 2008 and has done additional training in advanced acupuncture, food therapy, herbal medicine, and veterinary orthopedic manipulation. Her special areas of interest include nutrition, functional medicine, gut health, toxins, and dental health. She's authored several articles and has lectured locally, nationally, and internationally. I know this is going to be a super hour too. Please welcome Dr. Katie Kangas.
Thank you, Julia. Really appreciate it. Really appreciate you all being here and coming back if you were here last hour. I know a lot of you were, which is awesome. I want to say two things real quick because of the many people that came up to ask me great questions. A couple of the questions came up a few times, so I just wanted to clarify for everybody that if anybody's interested in doing glyphosate testing for yourselves or for pets, HRI Labs, which are an independent organization that is really, their mission is to help get our food sources to be safer. And they do urine testing, and you can send in urine for your pet or for humans, and they are hrilabs.org for Health Research Institute. Secondly, the NutriScan test from HEMAPET, just so you know, is a saliva test. So the cool thing about that is that clients can collect it on their own. So if your client is interested and you don't carry the test, or for whatever reason, they can just buy the NutriScan test and send off the saliva and get the result themselves. So it's a super user-friendly test. So just wanted to share that. And now we get to move on to digestion as a comprehensive job, which I just had so much fun even just creating this title. It's so important. Like, I think we see so much IBD and we see so much diarrhea and we see so much what we identify as sort of small intestinal stuff. And there are so many organs and processes that are involved in digestion, and I think we kind of get narrow focus sometimes with what we can do with our treatments and not really taking into account all these other systems and things that we can be doing to influence our patient's health. So I think most of you know who I am already. I'm in San Diego. I do all kinds of cool integrative things in my practice. I no longer do primary care, but I do a lot of blood work. So I tell people for imaging, x-ray, surgery, you need your other vet, but I love to do labs. And I love my dog Sage, who loves to be in my presentations. So these are both pictures here in San Diego. This is on the Coastal Trail, very near to where we live in Del Mar. Super beautiful bloom going on. So we're back to the very important wisdom of Hippocrates, which is just such a great lead into digestion is a comprehensive job. So we could have spent hours, of course, many days on digestion because a lot of cool processes going on. So I had to pick 3 organs, but I have to tell you, I'm really passionate about what's going on in the stomach, you guys. So I had to pick the stomach. And then the gallbladder and the pancreas just seem to be like really nice team going on because these 3 organs all work together to perform the majority of the digestion of food, and they all produce and store secretions. So they have that in common. So this was my little trio of fun digestive organs to talk about today. So again, I think I pretty much said produce and store secretions to digest food. And also they produce hormones to coordinate functions, but that's endocrine function. So we're not even gonna go there. That's a whole nother talk. So we're gonna talk about exocrine and digestive today. So let's start with the stomach, and everything does start in the stomach. So that's a perfect place to start our discussion. So the stomach indeed does function as a storage organ. Food passes through it on its way to the duodenum, but there's a bunch of stuff that's supposed to occur in the stomach first, and that is often not being done well, so that's what we want to be looking at today. The stomach is creating gastric juice, which is a mixture of hydrochloric acid, HCl, and enzymes, and the initial phase when it's digesting food, it's supposed to turn that food into chyme, okay, like a liquidy, slurry stuff that is way more digestible by the time it gets to the small intestine, the duodenum, than if it's just a bunch of undigested food that races on through. So, fun fact, I tried to put some fun facts through this lecture. In humans and in large dogs and horses, the gastric mucosa should be secreting about 1.2 to 1.5 liters of gastric juice per day. It's going to vary, excuse me, in doggy breeds because there's a lot of small dogs, okay? So, and this gastric juice is going to initiate digestion, especially protein. So much protein digestion occurs in the stomach. And we really got to be thinking about that when most of our patients are carnivores. So if our primary patients are dogs and cats, boy, stomach function, I mean, it's important for everybody, but it's really important for dogs and cats. So what is the stomach secreting? It's secreting water, so you got to be hydrated or you're not going to be able to make good gastric juice. So if dogs are eating dry food, if they don't drink enough water, et cetera, it also mixes electrolytes in there. We talked about the acid, the HCl is super important. And then the stomach does release enzymes. The pancreas isn't the only organ that has that role. The stomach is releasing enzymes, pepsinogen, which gets broken down to pepsin. You're going to see how. And then some gastric lipase. And then we've got the glycoproteins, which are creating the mucin that's protecting the lining of the stomach as well from all that acid, as well as the bicarbonate. So mucus and bicarb layer is that protective layer that's going to protect that whole barrier environment. So stomach function, again, the hydrochloric acid is imperative to break down proteins. And that is because pepsinogen, which becomes pepsin as the main enzyme in the stomach, requires acidity to get pepsin to be created from the pepsinogen. Sorry, I lost my train that I wanted to use there. But and that is going to cleave proteins into smaller peptides. So the pepsinogen is released by the chief cells, the gastric chief cells in the stomach, and that acidity is required to convert, that's the word I wanted, to convert pepsinogen to pepsin, okay? That is gonna happen at a pH level of 1 to 2, okay? Pepsin is the enzyme with the most efficient ability to break down proteins. And here's a study that showcases that. Okay, they looked at the pancreatic enzymes and found them to be remarkably inefficient, the pancreatic proteases, okay, the ones that are supposed to break down proteins, remarkably inefficient at cleaving native folded proteins, whereas pepsin, which acts at a very low pH, was much more efficient. This indicates that pepsin is the prime enzyme cleaving native proteins, and that the pancreatic proteases are primarily involved in just generating the single amino acids or very short peptides for efficient uptake later in the intestinal mucosa. So if the stomach doesn't do its job and it's not acidic enough and pepsin is not converted from pepsinogen, then the whole process starts to go south at the very beginning, especially when you're a carnivore. So that's what's going on with the pepsinogen. Now, the hydrochloric acid is secreted by the parietal cells in the stomach. Gastric acid is going to aid digestion by obviously creating the optimal pH for pepsin to be created, to be converted, as well as the lipase. And it's going to stimulate the bicarb secretion. Gastric acid is essential to liberate B12 from protein. So if you do not have a good acidity in your stomach, or the pet doesn't, then they're going to be B12 deficient. And it's also required for the absorption of a lot of minerals, which I didn't even realize until I started delving into all this research how important it was for that. I knew it was important for B12, but it's very important for iron anemia and zinc deficiency and even proper calcium absorption. And the other thing that acidity is really important for, which Dr. Odette Suter will like to hear this, is for killing undesirable microorganisms. So if you do not have an acidic stomach, you are very likely to get an overgrowth of pathogenic organisms in your gut and a dysbiosis. So the acid in the stomach is keeping everything in check. So studies have showed, this is interesting, studies have showed that dogs and cats have a lower basal rate. So just in between meals, just like day in, day out, food's not coming in, that dogs and cats have a lower acidic rate in their stomach versus humans, by and large. But they have higher peak gastric acid responses to incoming food. Well, that makes sense, they're carnivores. So if food comes in, it should be primarily protein and massive acid production. So gastric pH in humans increases, meaning it gets, higher pH, more toward alkaline, with food intake from the buffering effect of food. So we eat a bunch of food, and then our acidity level in our stomach falls a bit because that food is buffered it. This effect is minimal to absent in dogs and cats, which is really cool. Their stomach is supposed to stay super acid, superpower acid. And the gastric pH they've measured in healthy dogs should have a median of 1.1 and could be as low as 0.5. I mean, that's a super acidic stomach. So now we really set the stage for the knowledge base that the role of the stomach is incredibly important because it has to break down proteins. And these proteins are not getting broken down if the stomach is not performing well. We really got to be keying into how important acid is because a lot of our patients are being put on antacids chronically, and humans too. This all applies to people. So people are going to want to go home and do some new things, which is awesome. All right, so now we talked about how important acid is. How many people think that gastric reflux is caused by too much acid? Okay, good. Or no one's admitting it. That's cool. Well, Western medicine, and either way, it's fine. But most MDs in Western medicine, and even a lot of veterinarians, obviously conventional, practicing veterinarians, when there's gastric reflux symptoms, are like, oh, there's too much acid. We need an antacid. We got to neutralize that acid, or put them on a PPI and stop acid production because acid is bad because it's coming up. And I love to tell my clients there's acid in the stomach for a reason. It's imperative for your dog to be able to digest well. So we don't want to constantly thwart that acid. And my mantra that I always give all my clients is, I'm okay with anything short term. If the patient is suffering and they are miserable, and the symptoms are really horrific, go ahead and do, an acid short term and see if it helps, because sometimes it doesn't even help, and that's good information. But we want to come in with long-term solutions so that we can get these pets off the antacids, okay? So not only will the stomach not be able to digest food properly without acid, but again, it's going to lead to bacterial overgrowth. And the big kicker on this slide is that the majority of the time that there is acid reflux issues, it's from too little acid in the stomach. It's just the acid's in the wrong place. So what happens is that when there is not enough acid, the protein is not digesting well. It's starting to ferment and kind of putrefy in the stomach, and then gas bubbles are created from that fermentation process. Things aren't digesting well, and then a little bit comes up with gas, a little acid comes up into the esophagus, and there you got your acid reflux. But it is rarely from too much acid. It's almost always, in humans too, from too little acid, and there's tests that can be done for that. We're actually going to talk about that in a second. So food sensitivities and food intolerance. Again, poorly digested proteins are going to be an issue if the stomach doesn't have enough acid. And so this is going to cause a high production of antibodies farther down when this food gets moved into the duodenum and the small intestine, and it has not, these proteins have not been broken down well, then that's going to trigger inflammation and trigger kind of, an immune response. And here's a nice graphic to show you that. So these big protein particles are moving into the small intestine, and the small intestine's like, bah, what's that? I'm not supposed to see molecules that large. I'm supposed to have these nice little peptides that have already been cleaved, and I can do my thing, and now I can't do my thing, so now I got to turn on the antibody response, and everything goes haywire. Well, that's why we have these HP diets. Now, this totally makes sense, and not that, we know that any patient, dog, cat, human, you could be reactive to corn or soy or, some of these carbohydrate things, but it's interesting that the veterinary industry has figured out that it's the protein that looks like it's the major cause of extreme inflammation and reaction and food sensitivity and food intolerance, which is why first it was novel protein diets, and now the big thing is hydrolyzed protein diets. Well, what is hydrolyzed protein? It's protein that has been broken down into like micro nanoparticle size so that the body doesn't recognize it as protein, and so it's not reacting to it. Well, that makes sense if we had a better functioning stomach, good stomach acid, good pepsin, that maybe we wouldn't need HP diet in the first place because our proteins would be broken down. But if there's a lot of inflammation in the intestine and it's in a full tizzy, then like I said in the previous discussion, HP diets can make sense for a while, but I don't like to stay there. So it's good to remember that everything is connected. It starts with the stomach. And if the stomach isn't performing well, then the small intestine and all the other digestive organs are not going to be able to do their job well. Again, everything is connected. We have allergy system, the lymphatic system is all tied into this. The liver, it's showing bidirectional. There's a lot going on between digestion and hepatic function. But the stomach to the large intestine, or to the small intestine to the large intestine, that all starts with the stomach. So it's really nice to pay attention to how we can support gastric function, optimal function for our patients. So this is a big topic. There's a lot of things that are reducing acid and causing this hypoacidity or hypochlorhydria issue that our patients are getting, and humans too. And simple aging is one of them. For humans and pets, the older you get, the less likely you are to be creating optimal amounts of acid, okay? So older pets could use, generally, and humans could use stomach acidity support. Antacids, clearly a big deal. Antibiotics make a difference too, and so do NSAIDs, corticosteroids, glyphosate, our very not friend, the pesticide, and then heavy metals. And then two biggies on the bottom of this list too, dry food diets and dehydration. Again, you saw what the stomach puts out. Water was the first thing on the list. So if we have pets that are eating chronically dry food, it is really hard for the stomach to create enough acid because it's like the dry food's just soaking up all the water. So if your clients are going to feed dry food, even though soaking the food isn't going to change the fact that it's heavily processed, still soaking the food should be, metabolically a really great thing to do, because that is going to help the stomach to perform better by hydrating that food. So it's coming in hydrated. So here's a really interesting list, because these are the symptoms of too little acid in the stomach, hypoacidity. Well, they're all the same symptoms that a lot of people would think is with too much acid in the stomach, okay? Reflux, heartburn, burping or belching between meals. I always ask these kinds of questions of all of my clients. I literally ask almost everything on here. Are they doing this, 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 this? If they, I say, do they burp? And people are like, oh yeah. And I'm like, when? Oh, right after they eat. I'm like, okay, I'm not worried about that. They just, dogs don't chew, they eat a whole bunch of food, they're gonna burp. But if they're sitting around burping and belching between meals, that's a problem, okay? Lip licking, lip smacking, hard swallowing. I ask about that. Those are all indicators that there could be some reflux going on. And this is the biggie, and this is why I put it in red. Retching, gagging, throat gagging, coughing. I will tell you, in my experience, 80% of the time that people tell me their pet's doing that, I find out that it's gastric reflux. And they're often worked up as respiratory, kennel cough, bronchitis. I get pets they're on hydrocodone for years, and then we treat their stomach and support their stomach, and the cough goes away. Yay! So don't forget about coughing and gagging as a gastric symptom. And then poor or finicky appetite, especially in the morning. So if these dogs don't want to eat, they just are feeling indigestion, the stomach just doesn't feel good. Think about that. I always think about the hypoacidity and that issue. Gas, especially if it's really smelly, but gas and bloating. So some of the human naturopaths I follow, I remember seeing an article that said if you have gas that's not smelly, you are likely not digesting your carbohydrate and vegetable matter well. But if you have gas that's really smelly, you are likely not digesting protein well. Okay, and some of the indicators on some of the supplement products, even from Standard Process, that help to replenish stomach acid, say right on the label, one of the indications is gas. So it really helps to digest the food better, to eliminate that gas problem in the first place. Then we have abdominal pain. If if your clients are telling you their dog is stretching out in the prayer posing, panting during the middle of the night, or panting at any time, but especially in the night. I have had patients where they've worked up all this stuff with their vet, nobody can figure it out. Is it anxiety? Is it pain? What's going on? They're just panting in the middle of the night, I don't know. And I question them, are they lip licking? Are they lip smacking? Well, maybe, I don't know, but I'm trying to sleep. I really don't hear that. I just hear the panting. And so I will support their stomach acid. I might start with slippery elm and marshmallow root and kind of the calm, but then replacing the stomach acid. And so many times I've had people literally just like, I can't believe you fixed the panting problem, that nobody could figure out with my dog is that they were having indigestion in the middle of the night. It's classic. And in the early morning too. Loud stomach noise, grass eating, also big tip off there's something going on in the stomach. And then of course, because food's not digesting well, you can have undigested food in the poop and or bad stools, yucky stools. All right, so another fun fact coming up, acid reflux in humans. I just pulled this off because it was on a little write-up and I was looking like, how do we test gastric acid? Because I'm not familiar with really any tests that are easily done for animals or humans. And there really isn't, but there's a little home test you can do. But it does list that hypochlorhydria, low stomach acid for humans, gives symptoms of chronic acid reflux, laryngeal-pharyngeal reflux, and heartburn, and that poor digestion from lack of stomach acid results in stomach gas, and even trace amounts coming up in the throat are uncomfortable. Humans report this. So if you wanted to get your gastric acid checked, there's some things you can do. There's like a string test where you have to swallow a string and then bring it back up in 10 minutes. That sounds really unpleasant. There's also a smart pill. I'm like, that sounds creepy, don't want to do that. And so I'm like, I'll just do this baking soda test, but I haven't because I support my stomach with betaine hydrochloride. But if you want to test your own stomach acid, this is pretty cool. It's not totally reliable, but it's thought to at least be somewhat reliable to give you an idea that you can do a 1/4 teaspoon of baking soda in 4 ounces of water, drink that on an empty stomach, and if it takes you longer than 3 to 5 minutes to burp, you may have not enough stomach acid, because obviously something that's alkaline and acid should create fizzy bubbles and you should have to burp pretty quick. All right, so again, just to sort of reiterate, the importance of stomach acid is huge. We need it to break down the food properly, but we also need it to liberate certain nutrients, including, as we talked about already, cobalamin and a lot of minerals as well. And then another important thing is undigested food left in the GI tract is going to promote overgrowth of pathogenic bacteria and SIBOs and even gastric infections. So H. pylori in humans is definitely linked to hypochlorhydria, okay? And then in my experience with animal patients, I see a lot of E. coli when I do the animal biome testing, the microbiome testing. These dogs that struggle, and I'm sure you guys have had patients like this, the amount of reflux or the intensity of reflux symptoms can be severe. Like I have patients that are like, my dog literally will gulp and just, just beside himself for like 45 minutes after he eats, like long term. It's really crazy. But point being is when I have patients who have a lot of reflux symptoms and I do an animal biome test, more often than not, they have an overgrowth of E. coli. So really interesting. When I started researching this stuff, I'm like, oh, that's why. Okay. So, here's a great article. I was so happy when I found this to put this up from Internal Medicine Journal. And this was back from 2018. Telling veterinarians, be cautious about the overuse of antacids. So thank goodness, this was 5 years ago. Similar to the situation in human medicine, the practice of inappropriate prescription of acid suppressants is commonplace in veterinary medicine. We all know this, it's not a secret. This report challenges the dogma and clinical practice of administering GI protection for routine management of all these different GI diseases, gastritis, pancreatitis, hepatic and renal, if they are lacking additional risk factors for ulceration or concerns for bleeding. There isn't an indication to be using these antacids. Judicious use is warranted considering recent studies that have documented adverse events of long-term supplementation of PPIs in both animals and people. And everybody knows PPIs is omeprazole, right? Prilosec, proton pump inhibitors, which is shutting down. So the initial antacids, Tums and calcium carbonate and Pepsid, famotidine, ranitidine, they were neutralizing the acid. But PPIs shut down the stomach's ability to create acid. So it's really a big deal. All right, so what can we do to support the stomach? Digestive enzymes, as I said, everybody's friend. And I love to see pepsin in the digestive enzyme lineup because now we all know how important that is. But all of these enzymes can be beneficial. And then betaine hydrochloride. And and Standard Process has a product that combines pepsin and betaine hydrochloride, so it's beautiful for stomach support. But there are digestive enzyme powders that include betaine hydrochloride in them as well. So cool stuff that can be used. All right, we're going to move on to the gallbladder. I have to put a pause on my love for the stomach. Gallbladder is pretty cool too, though. So gallbladder function, obviously the primary function is to store and concentrate the bile. The bile is being made in the liver, so it's synthesized in the hepatocytes and then goes to the gallbladder to store. And then when the body ingests food, especially fat in the meal, then the gallbladder is supposed to contract, release the bile into the duodenum. And then the bile there will emulsify the fats so that they can absorb and digest, okay? It takes some effort to do that. So we need our bile. Bile is also important for the absorption of fat-soluble vitamins, okay? So if you don't have good flow of bile, not only are you not absorb your fat, but you're not going to absorb your fat-soluble vitamins either, and lo and behold, also minerals. And mineral deficiencies are such a big deal. I mean, they're causing so many different multifaceted problems. So another thing to be aware of. I had no idea till I started studying how cool bile is, that it also fights infectious agents. Dr. Odette Suter, I'm sure, knows about this too, but it truly does affect the microbiome, okay? Affects bacteria in the gut, dissolves and prevent, obviously, bile is helping to prevent gallstones if it's moving like it should. It also affects blood sugar metabolism. I didn't realize its role there, and you'll see that in a second here. It triggers the release of glutathione, which is darn cool, and bile is a detoxifier. So again, mentioning the antimicrobial capacity of it, it's disrupting bacterial membranes. So if there is a decrease of flow of bile and bile salts in the body, then you can get an overgrowth of pathogens. And bile salts are providing environmental signals for bacteria, so really helping to regulate and modulate the microbiome. All right, so here's its assistance in blood sugar metabolism. I did not know this prior, but bile stimulates receptors to assist in obviously fat, but also carbohydrate metabolism, and that it affects blood sugar and the regulation of glucose and lipid and all energy in the body, and that it's supporting the homeostasis of glucose in the body. So there are reports showing that they're looking at it as bile or bile salts as a potential therapeutic target for diabetes patients. That's pretty cool. So a fun fact, increased bile flow is also going to support increased glutathione levels in the body. And of course, glutathione, master antioxidant, protecting tissues, is also assisting to detox and protect the liver from oxidative injury. So the more bile, the healthier the liver as well. So it's a nice little hunky-dory relationship going on there. All right, so gallbladder disorders. We certainly see plenty of these, right? Cholecystitis, cholelithiasis, common disorders. Cystitis meaning inflammation of the gallbladder that can be associated with infection or just stasis. Bile's just sitting there for too long. Things get inflamed. Cholestasis, impaired flow, sludgy bile. I tell my clients this all the time. You know, so many dogs and humans and cats have sludgy bile. It's not moving. If you see these ALPs, you know, that are really hot, you know, ALP, I start thinking, you know, bile route on the lab work, especially if the ALT and everything else is normal. I'm thinking about how do I help that patient move their bile, okay? We're all familiar with gallbladder mucoceles. And then, of course, if that sits around too long, then they're going to get a stone. So super fun fact, sludgy bile can be moved. And you don't always need ursodiol to the rescue. Okay, although that can be used, bile salts. And there's natural forms of bile salts too. But there are food and nutrients that can help move the bile and stimulate the flow. And some of these, well, it's betaine. And I was going to say some of the foods that have really good, rich amount are beets. So anyway, betaine, our friend that's coupled with hydrochloride, betaine hydrochloride, well, betaine by itself, amino acid that supports the removal and breakdown of fats as well as toxins and chemicals. And what it's doing is it's lowering the viscosity of bile so it's not so darn sludgy and helping it to move. So it's allowing it to flow through all those ducts, okay, and into the duodenum where it's supposed to go. And it's rich in certain foods, as I mentioned, beets and spinach, as well as some others, wheat germ. Lo and behold, I had to highlight this study because Standard Process is indeed sponsoring these presentations, which I'm thrilled for because these products are really, really useful. And here's a study that was done recently in humans, but I will tell you I use these products in dogs all the time. There are a lot of the products that are designed for humans in the Standard Process company that can be used for pets. This particular product called AF Beta Food was studied in gallbladder function. And I'm going to pull out some of the nuggets of good information. Gallbladder wall thickness is actually something they're looking at to measure gallbladder health, okay? Because when a gallbladder wall is too thick, that influences the mobility, and so it's going to sit around, okay, and the function of it. In this study, humans that took AF Beta Food, their product that, by the way, has beets and beet leaves as some of the main ingredients. The AF Beta Food does have some glandulars. They have just simple beta food with just the plant material in it, which is also awesome. And you can talk to the Standard Process people, obviously, at their booth if you're curious about the difference in what these do. But anyway, it resulted in a significant reduction in gallbladder wall thickness compared to placebo, resulted in a 9% decrease in gallbladder wall thickness, whereas the placebo group showed a 7% increase. Okay, so obviously this suggests that it's helping the motility via reduced wall thickness. So the other thing they pointed out is that gallbladder volumes of just what's hanging out and sitting in the gallbladder in healthy individuals and individuals with gallbladder disease is vastly different. So a diseased gallbladder or an inflamed gallbladder is going to have more volume. It's going to be larger because things aren't moving out of there. That makes sense. So fasting gallbladder volume in healthy adults is much lower than in individuals with gallbladder issues. Observational data looking at this particular supplement to support this issue showed that there was a result after 12 weeks with a 9% increase in mean fasting volume, whereas the placebo resulted in an increase. Okay, so it decreased the volume in the gallbladder, so that's good stuff. Okay, so cool case study just to show you a little, there's multi-factors going on here, but still this meant a lot to me, this is actually a friend's dog who's a veterinarian, a colleague, and this x-ray was taken in 2019, and she brought it up on her phone. We were hanging out with a bunch of vets. We have vet friends, and we were in a little group, and she goes, "Oh, my little dog, Turtle, has what looks like it's either a stone or gonna turn into a stone sometime soon in her gallbladder, but she's totally asymptomatic." And there was a board-certified surgeon in our group who I adore, and he goes, "Oh my God, you got to get her to surgery, like now, before that ruptures. That's going to rupture." And she's like, "Well, but she's asymptomatic, and you really?" "Oh yeah, because and he's like, "You definitely have to go to surgery. You have to get that out before it's a problem." And I said, "Well, if she's asymptomatic, why don't we try and move that bile? Because you really want her to keep her gallbladder. Gallbladders are important. We don't want to just lop them out if we don't have to. Let's support them to do their thing." So she put her on beta food or AF Beta Food. She didn't actually use ursodiol. And then she didn't follow up with an x-ray because she got busy and everything was fine and there was no symptoms. But a year later, she did an ultrasound with one of our internal medicine specialists here locally, and it said right there, normal gallbladder, mild amount of stuff in there, no cholelith. So it's pretty cool. I've seen it work. This was just one that I could come up with really easily. So there are also excellent herbs to support, and herbs and nutrients to support bile function and flow, okay? A lot of the same players that we're familiar with for liver support are gonna support gallbladder and bile health, okay? Milk thistle, artichoke, dandelion, cilantro or coriander, a lot of good things in here. Turmeric is superpowers. And so they're stimulating the release of bile, cleansing and detoxing, and also preventing inflammation that's gonna cause problems stagnant in the gallbladder. All right, functional foods. I love functional medicine, so of course we want to talk about glandulars and things that we can feed the body to support better gallbladder health and better bile health. Again, these can be nutritional supplements or they can be whole foods or dried foods, but obviously liver, intestine, tripe, stomach, any of the intestinal extracts, spleen, kidney. Again, these are all going to support liver metabolism, hepatic circulation, more bile production and flow, and response to immune challenges in these organ systems. All right, so Now we know the importance of the gallbladder and bile. We're going to move on to pancreas, our third and final superstar player in this trio of digestion organs. And everybody knows the pancreas has a lot of functions. It has dual roles in exocrine, which is of course our digestive function, and then endocrine. And again, endocrine's a whole nother discussion, so we're not going to go into that. We're going to focus on what it does for us in digestion. And again, it's storing and secreting pancreatic juice, supposed to obviously release that into the duodenum to complete the chemical digestion of food. And I highlighted this, that began in the stomach. Again, if the stomach is doing its job well, the pancreas doesn't need to get so ticked off by the time the food makes it to where the pancreas has to play its role. And no wonder why we see so much pancreatitis. You know, I mean, there's a lot of multi-factors going on, but if these other organs are doing their job, then the pancreas can do its job better too. Okay, so fun fact, most people probably know this, dogs and cats do not have amylase in their saliva. Okay, herbivores and we, you know, have some capacity if we're chewing our food. Most people don't chew our food as well as we should. We know dogs don't chew, you know, and that's clearly, so why would they be given amylase, especially because they're not designed to eat a lot of starches and fibers either. So they weren't, dogs and cats weren't given this. So here's just a study that just showcases this. As in most mammals, the highest amylase content was found in the pancreas. This is a feline study. Levels in the saliva and salivary glands were very low. So the pancreas is under a lot of demand to give amylase in any dog or cat that eats a lot of carbs, which is really unfortunate because so many pet foods are loaded with carbs. So pancreatitis, we see a ton of, acute or chronic, occurs in both dogs and cats, was thought to be underdiagnosed in cats for quite some time. I think more and more people are catching on to abdominal pain and chronic GI issues with cats, likely involving some pancreas issues. My big sort of pet peeve is that, at least in conventional veterinary medicine, primary vets and even specialists, once a pet has had pancreatitis, they want to assign them a low-fat diet for the rest of their lives. And I totally agree that when you're in the middle of a pancreatitis crisis, that a bland, limited ingredient diet is very wise, but I don't think a life sentence of low fat is a wise choice. And there are so many things we can do to support the body to be able to digest fat better so that we can get back to a healthy status, including fat, because it is so important. Okay, so fun fact, obviously, the average pet food, the average dog food, cat food would be lower, but still there's a lot of peas and chickpeas and all this stuff that they can list as protein, but still a lot of carbs in cat food too. So it's really stimulating the pancreas to create a lot of amylase. So here's just one study that was highlighted in nutrient requirements for dogs and cats back in 2006. One study demonstrated that the amylase activity in the duodenum of a dog fed dry food was 8.5 times higher than a dog fed a raw food diet. So chronic overstimulation is really placing a demand on the pancreas for pets eating standard diets. So as I mentioned, treatment plans often include a low-fat diet for a long time, if forever. And it's really important to remember that healthy fats and lipids are essential for long-term health. Not only will our patients won't absorb their fat-soluble vitamins, their vitamin D, their vitamin A, their vitamin K, vitamin E, but they need it for hormones. Thank you. And the endocrine system is incredibly important. So if you don't have any fats in your diet, or you have a low-fat diet chronically, you're going to start to have some major metabolic stuff going on. And it's very important for the brain. Lipids are important for the brain. How many people knew that the brain is 60% fat? Lot. And of that 60% of the fat in the brain, 25% of it is cholesterol, which is super important for brain function. Okay, so a lot of people, including our clients, bought into that low fat craze of the 80s and 90s, and everybody's like terrified of fat. And now we're really realizing that it's sugar and carbohydrates that are causing a lot of that degeneration, and fat is not evil. So, all right, so EPI, let's move on to the other type of pancreas disorder that we see a lot, which is exocrine pancreatic insufficiency, where there is a lack of production of digestive enzymes. Again, in this scenario, digestive enzymes are their friend and their necessary friend, because in this case, the pancreatic acinar cells, or acinar cells, have shut down. Okay, they're not producing digestive enzymes anymore, and this damage, this occurrence, can come about because of inflammation. Okay, and maybe it's because of the overstimulation of the pancreas and whatnot, other things, and then the duct can get blocked as well. So the symptoms, we're very familiar with this disorder: malabsorption, maldigestion, loose stools, profuse diarrhea, light pale color stools. We're very familiar with that. If there's fat, undigested fat in the stools, the color will be off. Weight loss, big time. These dogs are so thin and emaciated. Excess appetite, sometimes pica and coprophagia, and then poor hair coat because they're not metabolizing nutrients that are really important. Sometimes vomiting. And so here's an important, I think, little factoid, is that EPI is generally not going to occur until 90% of the exocrine pancreas is already non-functional. Okay, so by the time it shows up symptomatically, there's a lot of damage going on. Everybody's very familiar with the TLI test, which is what we're going to use to diagnose that. Don't forget about cobalamin and folate are often altered in an EPI situation, a malabsorption situation. So this I pulled out of Canine Internal Medicine Secrets and Canine and Feline Nutrition. Maldigestion and malabsorption does not just result from the enzyme deficiency. That's a big deal of it there. But this disease also leads to changes in the small intestinal digestive process, and that there's SIBOs going on too. It also called out in this article that vitamin absorption is generally going to be inadequate. So we need not only to just be giving digestive enzymes, we need to be supplementing these guys with vitamins and other nutrients that they're not getting. Okay. So this particular article, Anthony Carr talked about enzyme replacement, which could be powdered enzymes added into each meal. He also mentioned fresh pancreas, yay, glandulars, so that you could do that as an alternative option. Talked about cobalamin supplementation, other vitamin supplementation. I would be looking at vitamin D and everything else too. And then also he referred to treating SIBO if needed, and listed some of the medications that they would use conventionally to do that. Although I'd be looking at a microbiome transfer and supporting the biome in other ways as best as possible. So again, digestive enzymes is the same slide, and you know this all already, but just to mention, not only for EPI, but for any other digestive stuff going on. Again, if they're eating a fresh food, species appropriate, never been heated diet, there will be enzymes in there. Although if they're having a digestive issue, I would still add enzymes into especially if they're having a stomach issue, betaine hydrochloride and so forth, into a raw food diet. But definitely if they're eating heavily processed foods and high starch and high carbs, they will benefit from enzymes being added to the food. And we're getting near to wrapping it up. We're going to talk about nutrients and herbs and mushrooms and other things that we can do to support the pancreas. So omega-3s, so this is really cool, is again, a lot of people avoid fats with pancreatitis. But then I started seeing records coming into me from patients that I share with internal medicine specialists, and I would see right on the internal medicine specialist report, start omega-3 fatty acids, and I'm like, wow, they're recommending fish oils for pancreatitis. Everybody was so worried about using those for a while. So now internists are actually recommending them because it's been studied to support pancreas health. Other antioxidants, CoQ10, other nutrients and things like glutamine, and then herbs, licorice, dandelion, and then those magical medicinal mushrooms have their place too. So just a spattering of studies to show you a little bit of what's out there. Omega-3 fatty acids protecting in acute pancreatitis, having better success rates with those patients, protective effects of CoQ10 with pancreatitis, and then glutamine as well, bringing a better outcome of patients with pancreatitis. Omega-3 fatty acids, as I just mentioned, I'm really glad that people are looking more at this, and not that I would add this initially right away, and certainly not at high doses, but just be thinking about implementing omega-3s in at some point when it's appropriate for that patient, even if they have a history of pancreas issues. Just be smart about going slow and low doses and stuff like that. So here's an article just to display that omega-3 fatty acids were found to be beneficial for preventing oxidative stress-induced pancreatic inflammation and apoptosis in the pancreatic cells. So definitely protective. Omega-3 is protective for the pancreas. And then there's a lot of herbs that have been studied and showcased to support pancreas health and healing. So licorice root, again, licorice is such a superstar, big time anti-inflammatory, actually been shown to specifically help pancreas inflammation. Dandelion as well, same. Calendula, a lot of write-ups on calendula actually reducing symptoms, just calming and soothing an inflamed pancreatitis, because pancreatitis is not comfy, right? It's painful. So calendula is actually reported to help reduce symptoms. Olive leaf, one of the main and active compound in olive leaf, is reported to protect liver and pancreas. And then rhodiola, there's some studies that I pulled up of protecting the pancreas in rats that were already compromised with renal function. All right, so licorice, this was just to showcase licorice. Furthermore, we observed that GZ significantly decreased the number of monocytes and neutrophils in the pancreas tissue. So this demonstrated that licorice attenuates acute pancreatitis signs and inhibits inflammation into the pancreas. So licorice, a good thing. All right, mushrooms, I think is our last wrap up here. Mushrooms, again, so many wonderful things that mushrooms can bring to the table. Reishi has been shown to reduce pancreatic inflammation. Several mushrooms, as we know, are protective for cancer, so that a lot of reports on protecting from pancreatic cancer for humans. And then the polysaccharides and all the nutrients in mushrooms that are supporting immunomodulation is a huge bonus as well. And this showed here that reishi was prepared from a cultured mycelium, and it markedly alleviated pancreatitis in mice. Okay, potential therapy mechanism of reishi on chronic pancreatitis might be intestinal microbiome dependent, microbiota. All right, we are wrapping it up. So in summary, supporting digestive function with a very comprehensive approach, not just thinking about the small intestine or the colon, where a lot of the symptoms seem to come from, is really going to help support our patients to a more successful outcome. And Sage is happy to put a face on that. And so the rest of my patients actually, like, whoop, whoop for gut health. And Standard Process and I thank you for joining us.